Most people, when they are depressed, receive one of a small number of explanations. They are told there is a chemical imbalance in their brain, or they are told they have unresolved trauma, or they are encouraged to practice behavioral activation, to get more sunlight, to exercise, to challenge negative thought patterns. These are not wrong, exactly, but they are incomplete. And for a significant number of depressed people, they are the wrong treatment for the wrong problem. Viktor Frankl, writing in the mid-20th century, proposed a taxonomy of depression that is still more precise than most of what contemporary psychiatry uses. He identified 3 fundamentally different forms, with different origins, different dynamics, and different, crucially, treatment implications. The first form is somatic or endogenous depression that arises primarily from biological causes: neurological, hormonal, genetic. This is the form of depression for which pharmacological intervention is most clearly indicated and most clearly effective. Frankl had no quarrel with biological psychiatry on this point. He was a psychiatrist himself, trained in Viennese medicine, and he understood that the brain is a physical organ capable of disorder. The second form is psychogenic depression rooted in psychological dynamics, in trauma, in developmental history, in unresolved conflict. This is the territory of classical psychotherapy, of working through, of insight, of the slow renegotiation of the relationship between past experience and present behavior. Frankl was not opposed to this work either. He understood its value. The third form is Noogenic depression, and this is the one that most changes the clinical picture. Noogenic depression arises not from biology and not from psychological trauma. It arises from a conflict of meaning, from the encounter with what Frankl called the existential vacuum, the gnawing absence of a reason to be here. The person in Noogenic depression may have a perfectly functioning brain, a reasonably integrated psychological history, stable relationships, and adequate material circumstances. And they are still depressed, in a specific way, because they have lost, or perhaps never found, a genuine answer to the question of what their life is for. The danger Frankl identified is misdiagnosis. When Noogenic depression is treated as somatic depression, the antidepressant may reduce the symptom load without addressing the source. The patient feels slightly more functional but no more alive. When Noogenic depression is treated as psychogenic depression, the therapy may produce insight and resolution but still leave untouched the underlying vacancy. The patient understands their history better. They still don't know why they are getting out of bed. He used an image that has stayed with me. He said that treating Noogenic depression with antidepressants is like giving morphine to someone who has just lost a loved one. The morphine addresses the pain. It does not address what caused the pain, and it does not move the person toward the only thing that could, a genuine re-engagement with meaning. This does not mean existential depression cannot be relieved by other means. Sometimes people in Noogenic crises are also biologically depressed. The two conditions reinforce each other, and treating the somatic component creates the conditions for the existential work to be possible. Frankl was not dogmatic about this. He was trying to expand the diagnostic vocabulary, not replace it. But what the distinction of Noogenic depression does, what it insists on, is that the question, what is wrong with this person, must sometimes be answered with nothing is wrong with them in the medical sense. Something is missing from their life in the existential sense. And those are different diagnoses with different paths forward. For the person sitting in what feels like an inexplicable depression, who is not obviously traumatized, who is not obviously biologically unwell, who has all the ingredients of a fine life and no sense of why it should matter, Frankl's framework offers something that standard psychiatry often cannot. It offers a name for the experience. It says, you are not broken. You are looking for something. And that search, properly directed, is exactly what the Logotherapy exists to support. Subscribe to the Psychology of Viktor Frankl to explore more of his timeless ideas.